You bet. Happy New Year.
Happy New Year. Meantime, insurers are reportedly complaining about serious problems still plaguing Healthcare.gov and a backlog of potentially hundreds of thousands of unprocessed insurance regulations. Bob Leshevsky is an insurance industry insider, president of Health Policy and Strategy Associates, and a former executive of a group benefits insurer. Bob, Happy New Year to you. So first, let me ask you for your take on this. They say it's sort of a total of 9 million, they're saying. 2.1 bought insurance on the private exchanges. 3.9 got Medicaid or are eligible for it, and 3.0 are those 26 and under. So they say the law has helped 9 million people.
Well, I think each of those numbers are right, but let's start over. First of all, we're getting a Medicaid expansion, no doubt about it. Millions of people will be added to Medicaid. There's that old saying, you can sell it a lot better if you don't charge anything for it. Medicaid's free. They're going to sign a lot of people up. We know that. They have signed up about 2.1 million people so far for health insurance in the private exchanges. And there are a lot of canceled policies out there. As I've said in this program before, I think about 85% of the people who have individual insurance will lose it by the end of 2014. But of all these canceled policies, many have been deferred to the end of the year. Many of the insurance companies allow that to happen. We don't know exactly how many canceled on January 1st. I think it's important to, in fairness, to say that. We do know, though, that in California, 800,000 policies were canceled January 1. We know that in the state of Washington, as of January 1, yes, and on January 1. And we do know that 260,000 policies were canceled on January 1 in the state of Washington.
What's your point?
About 40% of these are subsidy eligible and should probably be buying policies in the exchanges. So the 2 million number, the 2.1 million people who have signed up, some significant portion are people who have had canceled policies. The bottom line here, Megan, is that less than 10% of the uninsured so far, I think we can be pretty clear, have signed up for health insurance under Obamacare. And so it's not that great a result when you put it in that context.
And what are you seeing from the insurance industry about the percentage of sick people versus healthy? Because that's an important thing as far as this law goes.
We aren't going to know that for sure for a number of months, really. But we do know that the people signing up are older in age, which likely means they're sicker. But, it doesn't take Einstein to figure out that the first people through the door are going to be sick people here who've been desperate to get health insurance for years. So if you've got less than 2 million people signing up, and it's less than 10% of the uninsured, obviously, it's going to be a very sick population. Yeah. I mean, what Obamacare has proven is that they can sign the sick people up pretty efficiently. What they've got to prove between now and March 31st, when open enrollment ends, is that healthy uninsured people are going to want to buy this. And that's really going to be the challenge.
I don't know about pretty efficiently. I know a lot of our viewers who have been on Healthcare.gov might take issue with that pretty efficiently thing, Bob, but I got to leave it at that. Thank you so much for being here.
You're welcome. Good seeing you.